Hi, I'm Dr. Jonathan Pinnell, and I want to talk to you today about why when you come into our office, the history and the exam are such an important part of helping you with your neck symptoms. You see, we don't know when your neck symptoms started, and so we need to find out how long ago it was that these symptoms of yours started. Maybe it was just yesterday, it was last night, or maybe it's been going on for years and it's slowly building up. So once we find out how long ago it was that you first started experiencing some of these symptoms, then we want to know why. And so you know yourself the best, and we'll sit down with you. We'll really listen to you and understand, is it something where you're sitting 8 hours a day, 20 some years, where you're just slowly bending forward like this? It's always bothering you in through here. Or maybe you were in a car accident yesterday. Maybe you got hit by somebody. It's a bigger trauma. We need to know exactly what kind of damage it was and then how long it's been since that happened, because as you age, everything changes in the healing phase. And so once we understand how long ago it was, what exactly it was that caused some of these issues, we'll dig in deeper. We'll find out what kind of symptoms you're experiencing. Is it where it's locked up, it's not moving? Is it sharp? Is it aching? Is it dull? All of those things we'll go over because they give us clues. They're like little breadcrumbs along the trail to helping find out exactly what's going on with you. And then if we know, we can help. And so the history portion through there, again, so vital to know all those things. And then we'll go through the exam. We'll find out what is going on in your spine specifically by putting our hands on the spine, palpating through the muscles, through the joints, the bones. We want to see, are you too tight in one area? Are you loose? Is it a ligament issue? Are you really tight where it's the muscle issue? Is it just the joints not moving? Everything's locked up in there. All of these things combine and go together with what we find in through the history. We tie all those together, and then we've got a really good understanding of what's going on with your neck concerns that you're having. And once we figure out what's going on, like I said earlier, then we can help. So super excited to help you when you come into the office, get rid of that neck pain, get you back doing all the things you love. And we look forward to seeing you soon.